Hi, everyone. I don't know if it's morning or whatever it is. We have 3 papers only, so we can just, but we'll keep the same structure. So we have 10 minutes for each paper. We start with Vladimir talking about NTAs for Russia, several years. Thank you. You can start.
Let's start. Thank you very much for invitation. And generally, today I'm going to demonstrate a bit some information about NTA transfers in Russia before and within the crisis time, comparing the years 2013 and 2016, and making some comparison between Russia and Europe. So, generally, what is the main research framework? So the main points of the research are 2013 and 2016. Why we use it? Because 2013 is one of the most prosperous years in modern Russian economic history, with one of the highest levels of GDP per capita income. And generally, since 2014, we saw already cumulative decline, because it was explained somehow by the negative dynamics of oil prices. Then there was the cumulative effect of the decrease of investments, and also to the end of the year we saw the effect of the sanctions, mainly financial markets and so on. So in this case, what are our research tasks? To follow the changes in life cycle deficit and transfer flows within the crisis, and to observe and explain differences between Russia and European Union countries. We used, for comparative analysis, we used data from Agenda Project 2010. So, generally, sources, we used the sources of SNA from all the observed period, some administrative sources, and generally there were some challenges with harmonization, because we used mainly 6 different sources for the complete picture. Russian Longitudinal Monitoring Survey, different Росстат, Russian Statistical Agency, 4 different household surveys, and also for education we used a special survey organized by the Institute of Education by High School of Economics University. And still there maybe the results could be changed because of some additional harmonization of private education and intra-household transfers. So the comparative perspective. Here you can see the graph showing the situation with the life cycle deficit, and generally also we should observe that maybe it's not an easy task to compare 2010s with 2000s, for example, because the standards SNA 2008 was implemented in Russian statistics since 2011, and there is still a backward standardization, so the new years in 2000 are harmonized and adjusted by the new methodology, but still it is what we have. So generally, if we want to take a look at the dynamics now, we should see the picture only since 2011. So generally, as you can see, the consumption in million US dollars was the highest in 2013, and the same with the yield. Then everything went down. But generally, if you take a look at the US dollars per purchasing parity, we see that the picture maybe is not so dramatic. So generally, we see that the life cycle deficit still generally started to be higher, mainly because of the decline in labor income. And this deficit is was financed mostly by the asset-based reallocations, by making the Chapter 7 lower. So this is the same situation, but per capita in US dollars per purchasing power. So in these cases, we see that, of course, if we adjust it per purchasing power, the decline is not so dramatic. However, that's how it is used if you take a look at the graph. So these are aggregate indicators, And here, of course, we can see the effect of the demographic pyramid here. Yeah, and also some aging effect. And these ones are per capita indicator. We see that the yield, the income is going down, even in US dollars per purchasing power, and generally it's going down almost for all age groups. So just smoothly going down. If I take a look at the consumption, we see that it also somehow goes down, but not so dramatically. And in this case, when we normalize it, after the normalization of the consumption, we even can see that normalized consumption for 2016 sometimes could be even higher. And generally, we see that there is a very interesting change in the slope of the curve for the older ages. Something is changing, and we will go into details soon. So these are the net transfers and asset-based reallocation, as you can see. And also, if I take a look at the short conclusion, we find that the labor income due to the crisis, even after adjustment for purchasing power, dropped for all age groups, but the consumption declined in lower proportion. So in this case, we started to finance it by the asset-based reallocation, and mainly by the decrease in savings. So generally, if I take a look at the place of Russia in the European Union, what could be interesting here? Similarities and discrepancies. So generally, the period with the life cycle deficit, well, it doesn't change too dramatically from the European one. So yes, of course, the period started a bit earlier, no, maybe 3 years earlier in comparison with the European Union as it is. And generally, these similarities is explained mainly by lower consumption for the older ages. Of course, if we take a look at the differences, for example, in labor income normalized, Russia is red here. In this case here, we can see that the labor income profile is achieved his maximum earlier and decreases at relatively younger ages. But generally, we can see that it is still close to some Eastern European countries like Romania or some parts of Estonia and even Hungary and Romania and sometimes Estonia, sometimes close. It used to be close to Bulgaria if we look at previous periods of time in Bulgaria. And we should say that, of course, this profile is explained by the lower age of retirement in Russia, because the pension reform in Russia was organized since 2018. And generally, we can expect that soon we start to catch up and follow the same path as Eastern European countries did. So then private and public consumption also normalized. What is interesting here? As I already commented, the private consumption, especially for the older ages, normalized is growing. Yes, of course, we understand that somehow it could be explained also by the decline in the labor income, but still generally it is interesting. Then for public consumption, however, we don't see these differences, these significant differences, but for private we see. So generally, for consumptions, we have that it's relatively smooth and growing for the older ages. And in 2016, for example, the consumption for older ages will be higher than in average European Union in 2010, if you take a look at the agenda project. And for public consumption, there is a bit unusual health and education consumption. For health, as you saw, we have traditionally some spike, which is close, for example, for Hungarian situation for the year 0, if we don't smooth it. And generally, it is explained by the relatively high investments in the maternal and infant health, which is traditional for the Soviet system of healthcare and still traditional for the Russian system of healthcare. And for the older ages, we have relatively lower consumption in this case. For education, we have the situation with 2 peaks, and generally It could be somehow explained by the situation that preschool education and early school ages are becoming more and more um, expensive, both for public sector and especially for private sector, because of the growing out-of-pocket payments for their early development. And this idea is becoming widespread, but generally we can say that the parents are ready to pay, but in some regions, for example, there are no services for it and so on. In this case, we see the growing consumption. And also there was a sort of decline for the consumption of the higher education services, and generally it will be visible. And it is explained by the campaign for sanitation of the higher education commercial universities in Russia that took place exactly within the period of observation. So now you can see. So generally, this is health. You see that the situation is improving, for example, with total private and public health. Yeah, now it is growing, and life expectancy is growing in Russia, as a matter of fact. And with education, well, we see that, well, the consumption for the early ages, it's also growing. And as it used to be more unimodal, now it's bimodal. And if we take a look at the net public transfers, also we can see that it's somehow close to the Eastern European countries with relatively lower figures for the older ages, but the situation is improving. You can see that, for example, in 2016, there were additional transfers coming to generally older ages. There is also a very interesting spike at the age 80 plus, which is explained by the rule of the Russian pension fund, when the pensions of those persons who survived until this age, who generally achieved this age, is doubling. So generally, the pension is doubling for them. That's why you can see the spike here. So if you take a look at the age since 80 till 90, it will be spike and then the flat curve. So yeah, that's how it looks like, but we still can see that for the ages after 60, we still have a long way to catch up, even the Eastern European countries. Also, what is interesting here, if I take a look at the net intra-household transfers. Net intra-household transfers in Russia generally are characterized by the out transfers at the labor age are lower, and also in transfers at older age are more or less lower. We can find that in transfers at the labor age are a bit higher for Russia, and generally because of this we have the curve that we have, which is generally shows a bit lower level of net intra-household transfers if you take a look at the absolute figures in comparison with European countries. Maybe it could be explained somehow by the joint transfers from older generations towards younger, so something like the stepwise, for example, from older generations, from grandparents to parents, and then from parents to children, so coming stepwise, and maybe more generations living in one household. So because it could be somehow supported by this graph that generally the size of the household in Russia is not much higher than in some of the Eastern European countries. It's higher than in Europe, but not much higher than in Poland and Romania, for example. But generally the composition could be more multi-generational. And for the conclusion, we see that the crisis did not lead to the serious decline in consumption due to the asset-based reallocation. The private consumption of the older ages is increasing despite of the economic difficulties. The consumption for elder is still relatively low, and nevertheless, the older generation resources are used as a source of intra and inter-household transfers, which is very interesting. And the profiles in Russia look like Eastern European, and as the social system is developing in the same direction, we can expect the convergence. And for further development, I suppose that now we have materials for the dynamics since 2011 to 2019. And generally we found two surveys for NTA, but yeah, there are some challenges with the harmonization and regular adjustment of SNA by different standards. For example, the last adjustment was made at the end of 2019, beginning 2020. And thank you. That's all for the present. Thank you very much for listening.
Thank you, Vladimir. Thank you. Now we have Ivan's presentation, also on comparing different years for Mexico.
Hello everyone, this is Work in Progress with my colleagues of the Mexican team, Isalia Nava, René Lascano, and Elvira Cedillo. The goal of this work is to identify generational differences in labor income and consumption in Mexico during the transition from a period characterized by a closed economy with high economic growth and price stability to one with high volatility and frequent economic crises, but that ended with moderate growth, price stability, and open markets. Mexican economies have subdivided the entire period into shorter phases based on economic policies and indicators of the epoch. We use this categorization to guide the interpretation of results and the selection of cohorts for this paper. We hypothesize that generations born during the period of economic stagnation and globalization would likely have lower labor income and consumption levels than previous generations. Here I show the compensation of employees relative to GDP after 1970 to illustrate this point. We see that it declined abruptly after the first economic downturn of 1982 and then continued declining and closely related to the economic cycle. Data for labor income and consumption NTA profiles between 1992 and 2014, all expressed in constant Mexican pesos. I show in this figure the rate of growth of labor income and consumption, which grew at the same pace and followed the economic cycle very closely as well. Here I show the labor income age profiles for all years in our sample. Relative to 1992, represented by the orange solid line, labor income increased in 1994, but then declined sharply in 1996 during the aftermath of the 95 crisis and started recovering until 1998. Similar patterns were observed in the aftermath of the 2009 crisis. Here we have the profiles for selected birth cohorts by age, keeping the 1992 and 2014 age profiles. The 1965 birth cohort in green increased with age, but it was affected by the 1995 and the 2009 crisis, reducing the growth by age and shifting the peak at an older age. We can also appreciate that labor income will have increased for this cohort at a larger pace across age in the absence of economic downturns and delaying the age where it peaked. The 1955 cohort seems particularly affected by these economic shocks as well, perhaps explaining this large gap with the 1965 generation. We performed the same analysis with the total consumption, and the results across periods are like those for labor income in terms of real declines or stagnation at all ages during the aftermath of the respective economic crisis. In this case, a distinctive characteristic of the consumption is the flattened down of the profiles at all ages. Similarly, we observe a clear pattern of increasing consumption by age for all cohorts, with the effects of economic shocks shifting the trajectories to the right and delaying the age when consumption peaks for all of them. For instance, look at the 1965 birth cohort in green again. had no economic shocks had occurred, the trajectory across age will have reached a higher peak, perhaps 15 years earlier, at age 35 rather than 50 in this example. Although the previous descriptive analyses are very illustrative, we rely on APC methods trying to identify cohort trajectories not determined by age or period trends. However, the APC analysis has the disadvantage that APC effects cannot be determined independently because the linear identification problem. For that reason, we are using several approaches with different underlying assumptions for sensitivity. For now, we show only results for 2 of them. The median Polish approach removes the additive effects of age and period in the first step, and then the resulting residuals are then regressed on indicator variables for cohort membership using linear regression. On the other hand, hierarchical APC models are two-level cross-classified random intercept models with age nested within period and cohort at a higher level. This method avoids linear dependency by specifying age in the fixed part of the model and period and cohort effects in the random part. Labor income and consumption APC scores are then calculated using MCMC methods. The results for these two methods are consistent. That's a good sign, but we interpret them with caution and based on supporting data and economic events. All graphs represent fixed or random effects estimates of period and cohort trajectories. The period profiles are consistent with the economic cycle shown before. On the other hand, we have that for baby boomers and Generation X, we observe positive increases in labor income that peaks for the birth cohort around 1965, then it declines. The decline continued and became negative for the millennials cohort that were born during the period of volatility and economic stagnation. In the case of consumption, the period effects are very similar and closely related with the economic cycle again. In the cohort profile, consumption increased consistently for baby boomers and peaked for Generation X, to start declining for the millennial generation and turning negative by nearly 2000. As I said earlier, this is work in progress and we are still working on the Deaton and Paxson model for sensitivity. We are also planning to include NTA data from 2012 to improve our estimates. Finally, we are considering the potential mediation effects of education and work status, most likely in a follow-up paper. Thank you very much.
Now we have the third paper. Shun, you can go ahead.
Okay, thank you very much for invitations. I'm going to talk about daily lives of the concerns of migrant nurses and the care workers in aging societies struck by COVID-19 in the case of Japan. I focus on social aspect related to migrations by using my primary data. Japan has been dealing with ongoing COVID-19 and since March 2020. And in recent weeks, the country has seen the second rise in infections in metropolitan Tokyo and other areas. This continues to present threat to public health, especially in the country where 28.4% of the populations are elderly, with thousands of care facilities. This presentation introduces and analyzes the impact on the migrant nurses, elderly care workers, and situates the discussion with the country's accepting plan on care migrants during the current ongoing situations. This slide shows Japan is facing the second wave of COVID-19 cases. You can see the left side graph, the confirmed cases daily. And we can see 1,400 and more than 1,500 today cases. And you can see the right slide, confirmed cases in Japan cumulative. So we can see already more than 45,000 cases all over Japan. And 100 hospitals and elderly care facilities struck by COVID-19 already. And by end of May, infected patient residents and staff found more than 200 hospitals and 70 care facilities across Japan. And more than 200 patients infected hospital already dead. And a lot of stars, especially accepting positive patients facing the management crisis, their deficit is growing up daily. This is the number of foreign residents. And in Japan, it is growing, especially in recent several years, in parallel with aging of Japanese society. And as of end of last year, the number of non-Japan residents already nearly 3 million. This consists 2.3% of total population of Japan. And especially we have a lot of migrants from China, Vietnam, Philippines, and Brazil, and some other countries. And this graph shows transitions of numbers of Indonesians and also Filipinos candidates for certified care worker and registered nurses. In Japan, we can call Kaigo Fukushishi for certified care worker. They are national licensure qualifications. And those workers coming under Japan's Economic Partnership Agreement, so-called EPA, with several South Asian countries. And you can see the trends. The number of nurse candidates is limited, but the number of certified care worker candidates is increasing rapidly in the last several years, Indonesians and Filipinos. And we can see also the number of Vietnamese candidates for certified care workers and nurses are coming. The maximum number for each country is only 300 for candidates for certified care workers. And many big demand from Japanese employers, especially for care workers. And this photo shows Filipino nurses and care workers bound for Japan. And they are showing passports. In the Philippines, nursing cap is called passport. So many of them used to go to US or some other English-speaking country, but Japan is alternative country since 2009. And upon arrival, they arrived in Japan, they can be just for as candidate for registered nurse because they have to pass a national exam in Japan, conducted in Japanese, very challenging for them. And among 1,200 candidates, around 460 candidates already passed national exam as registered nurse. And I interviewed with one Indonesian nurse recently, and he said that he's afraid the second wave more than first wave. His hospital, few patients and the medical staff became infected. And he has to go to his hospital by crowded trains. And the medical staff have to work at the special ward of COVID positive patients, and they have to stay nearby hotel during the assignment period. And even he was also requested to work at the special ward. He declined it because he told me that the hotel does not provide halal food. I also have to take care of my children's homework during this summer break. His wife is not so good Japanese speaker, so he have to take care of their children even at home. The number of cumulative number of certified care workers candidates entering Japan is already more than 5,000 by last year. And we had expected more 700 candidates coming this year, but they are suspended because of pandemic. And I interviewed one Filipino certified care workers. She's working in Fukuoka, and she told me that about her daily life. I've been careful to avoid physical contact as much as possible, but I just find myself doing the residents that used to be touched that way, and they might feel uneasy or lonely if we stop touching them. And elderly families are not allowed to come inside facilities, so they become feeling very big loneliness. I also interview other Filipino non-EPA care workers and by Skype. And she told me that I still have old people, even now, in order to raise their minds at ease. I can understand what elder residents wish to say and ask me when I observe their eyes and the mouth. And she's quite trying to observe attitude on the mind of elder peoples. Even she has not very high Japanese language proficiencies. Japanese employers' evaluations of Filipino care workers is like this. Their distance with their client is very near, physically and mentally. Filipino care staff tend to hug them naturally. On the other hand, Japanese staff tend to touch them lightly. And Japan's new normal policy is let's avoid the 3 C's. 3 C means cross spaces, cross places, cross contact settings. The Filipino care workers tend to feel dilemma for this new rule because their talent is very useful in close contact settings. And generally speaking, most Japanese employers are satisfied with EPA care workers. And this is some survey shows that 65% satisfied. And most of them, 80% of them continue to employ such care worker under EPA. And the prospect of the supply demand of care workers in Japan, we can see this year, we have already shortage 0.2 million persons. And 5 years later, we might have 0.4 million shortage. And fulfillment rate will be just 85% 5 years later. Therefore, Japanese government is going to open their labor market to migrant care workers much drastically and much substantially. And beside EPA, Japan already established new visa categories in the last few years. That is nursing care, technical intern training. Sure, okay. And specialist skilled workers expected around 60,000 care workers in the next several years, but it might be wrecked because of this pandemic. And this photo shows many intern trainees are trained in Vietnam and also Myanmar. And they are much welcome because they are Buddhist, the same as most Japanese. However, they are still in the standby in their own countries because of the pandemic, and it's still unknown when they are coming to Japan. I just skip 2 slides, just slide So I made conclusions. In Japan, Filipino care migrant practices and the minds generally varied well, and a small number of care workers from neighboring Asian countries were expected to come to Japan in time of severe shortage of elderly care workers. This tendency, however, became uncertain due to prolonging global spread of COVID-19 infection. The ways and the level of commitments of Japanese government and the same countries are tested now. Migrant nurses and the care workers have concerned and the dilemmas that are not shared by Japanese workers in some cases. Their differential culture and religious values should be taken into consideration by their employers and the supervising body amid ongoing global crisis. This can be said even in other countries, especially developed countries. This is references. And those slides are already shown in the web of this conference. Thank you very much.
Thank you, Shun. We have now two discussants, Julien and James. In principle, Julien is going to discuss the first two papers and James is the other one, but feel free to do the other one. Okay. Julien. Thank you.
Okay, so first, thank you for this wonderful presentation. I really liked reading your PowerPoint and hearing from your presentation. I have some remarks for each of you. I will try to go fast. So first, for Vladimir, I would like to make two remarks to question. So about the first graph you introduced in your presentation, we can see that the life cycle deficit became positive before the 2014 crisis. I was wondering how conjunctural the 2014 crisis is or not. My knowledge on it are not really good. And I was wondering that the life cycle deficit will become trendly positive and with an increasing trend up to 2008, maybe mainly due to the 2008 crisis. And for sure, it will be interesting to differentiate what's the role of each of these two crises, to differentiate the impact of these two crises, if it's feasible with the data you have in your NTA pocket. And I also saw that there is the new SNA methodology, sorry, but I'm not sure that it will play a role in this life cycle deficit. Maybe it will be interesting just to notify it in your paper and to explain if there is a role or not. And for the future, it's the next presentation and the next session. It might be interesting to think about a paper that will compare the impact. So it will be in 5 years, but that will compare the impact of the 2020 crisis on core, because as you showed, consumption declined in lower proportions than labor income thanks to asset-based reallocation. And I will be really interested to see, let's say in 4 years, 5 years, one paper showing how, let's say, consumption decreased in several countries and explaining what was the role of asset-based reallocation and public transfer regarding countries and welfare state system. But it's for the future, it's for perspective. Even thanks for this wonderful paper. I really liked it. I will not discuss the method because I'm not a specialist of it. I really appreciated that you try to make it different methodologies to make it. Sorry, I don't find my words. Stronger. However, I particularly appreciated that you use several surveys. In this case, 7 surveys, in my opinion, that are an important added values, and some previous work like Chauvin and Schroeder, who only used like 1 or 2 waves for France, for instance. So for this paper, generation follows the same path over the entire life. What does it mean? So I think it will be important for your paper to insist on that and to show that I think the new APC method try to use more and more waves in comparison with the previous one. In my opinion, it's one of the main added value out of the methodology. However, there is something I'm not sure about. when you analyze the cohort effect with the APC method, you show result for the 1985 cohorts, and after we can see a strong decline after 1985. However, the last severe observation, this 1985 cohort was 30 years old. So it means that the cohort after 1985 will be younger. So what if it will not be true, but what if the post 1985 cohort will have improved the situation? You will not find this strong decrease. So what I will do is just to shorten the range, maybe stop, not showing all the cohort. I don't know, it's really only my opinion, but for sure we will see a decrease after 1985 and maybe stronger. That's what you're showing. And finally, I don't know if I have time, but I will be fast, Sean. So thank you for this very, very interesting presentation. And I was wondering, an interesting indicator is a share of people who died and who live in long-term facilities. It evidences how the long-term care facility system in each country is efficient or not. For instance, in Quebec, 60% of the people who died were living in long-term care facilities. And in France, it was only 40% for France. And in Quebec, some specialist evidence that the problem was that workers were moving from one long-term care facilities to another, let's say doing 4 or 5 long-term care facilities in one day. And it was a problem. The problem was not that workers were in contact with people, it was more this problem. So, so sometimes I'm wondering if we could have different rules, like if you're working in long-term care facilities, people need to have contact. So maybe avoid working in different places. And what is, I was thinking about that. I was trying to use your paper to think about NTA. Usually what we do when we do distributional NTA by immigration studies is we analyze immigrants and native, would generate by income, distribute, consume, and save resources. It will be interesting to analyze it differently, especially when you have a high share of immigrants for some consumption post. And it will be interesting to analyze which needs are fulfilled by whom at each age. And try to analyze, I don't know how to do that, but I was thinking about that. Let's think about something where we could analyze how people contribute to the consumption of other, and especially natives. And it will be a way to show the added value of immigrants. And that's it. Thank you.
Now we have James.
Okay. I just have a couple of, I'm going to make some comments on all 3 papers, actually. So in terms of the first paper by Vladimir, my only comment was, it's interesting, it's relating to kind of the development of NTA, in that we have there's standard, when it comes to cross-national comparisons, it's standard to have the kind of graphs that were shown in this paper. But it would be good as time goes by, that it'll become more and more standard, I think, that when you're looking at changes over time, that you'll actually include a cross-national comparison of change over time. So instead of graphing, levels by countries, you could, it will become more and more important, I think, to look at change over time in these things across countries as well. And I think you could probably do that with some of the European countries at the moment. And, it would be a good project too, because it seems in all countries, including my own, Australia, something big happened in the last decade where, labor income growth dropped, or even the levels dropped. So it would be useful to understand how different societies reacted to that, especially since we're facing another situation where that might be the case. Okay, now on to Ivan's paper. I will say something about the methodology, because I do kind of work in this area. And for that, I'm going to, I do have some slide to, okay, I'm going to just talk a little bit about intergenerational differences and inequalities and age cohort period methods, in at least my understanding of them. So these methods, ACP methods, are used to explore intergenerational inequality by a number of NTA teams at the moment. For example, Austria and France, as well as Mexico. Now, in these models, as I understand them, intergenerational inequalities are indicated by cohort effects, controlling for period effects. Now, in my own work, in looking at intergenerational inequality in Australia, I've used a different indicator, it's called the IGI index, that does not control for period effects. Now, the question is, what is the best method? So here's a graph from Ivan's talk, the standard cohort by age graph. So if you compare the two cohorts on the left, the gray line and the red line. So that gray line it's a millennial generation. The red line is a Generation X generation. So you can see practically for all of the ages, the millennials have consumed more than Generation X. So if you just looked at this graph, you would think that actually, the generation millennials are doing pretty well. Now, if you look at the cohort effects from the APC models, so just focusing on the right-hand model, the HAPC model, you see that around, as Ivan said in his talk, the cohort coefficients are highest actually amongst the Generation X, and they decline a lot. It start to decline amongst millennials. So actually it looks like millennials are doing pretty bad. But that's only because their period effects, the differences here where they're actually earning more income, or actually consuming more in real terms, is all that's captured by the period effect. Now, in terms of the actual experience of people living through their lives, it's actually the millennials that are consuming more. So I wonder about the role of whether these cohort effects are actually good measures of intergenerational inequality. Now, I think you can think about this similarly to, just say if you're interested in gender inequality in income, and you've got two measures. You've just got the gender gap in mean income. And so, that of course shows women are a bit earn less income than, or receive less income than men. Now you could take another approach is to run a multivariate model and then look at the gender effects. So just say you have, your model is dependent variables income, independent variables of gender, and responsibility for childcare. Now it could be, just say in some world where you run this, where there is a gender gap in income, you run this model and it turns out that actually the gender coefficient is 0, but it all operates through responsibility for childcare. And as it turns out, women do all the childcare. So you could say, oh, well, we look at the gender coefficient there and it's 0. So there's no gender inequality in income. But actually, so then you have, it all kind of operates through another mechanism. So I think in this case, anyway, I think my general conclusion is the coefficients in multivariate models can be important for understanding the processes that generate inequality between groups. So they're important for understanding what's going on, but they are not necessarily good indicators of overall inequality between groups. Okay, that's all I wanted to say about Ivan's paper. My only comment on the Japanese paper was that I guess there is an issue. What will happen with one of the problems mentioned in the paper was whether this would continue in the aftermath of the COVID pandemic. And I guess my only observation was, it will be interesting to see what happens. And it could be the case that, depending on how these different countries, Japan and also where the migrants come from, how they deal with COVID in the long term could, it could actually be positive for Japan. If Japan does well in dealing with the COVID pandemic and Indonesia or the Philippines really goes off the rail, it's quite possible that it could be a bonus for Japan. Anyway, those were my only thoughts on those three very interesting papers. Thank you.
Thank you, James. Very good discussions, but I will just see if anybody else wants to add some discussion point in a couple of minutes.
I do. Let's see. I think I'm unmuted. Well, I enjoyed all the papers very much. I was interested in Yvonne's treatment in the age period cohort model. I thought some of what James said was very interesting about that. But I'm also thinking that there's quite a bit of research in labor economics in the US, at least now, that suggests that you might say in period shocks also then affect the cohort throughout its lifetime and the age pattern of labor income thereafter. I'm thinking particularly of generations that enter the labor market in an economic downturn. It turns out it's not just a period shock then, but it's going to have long-term effects on their earnings and job prospects that may wear off very slowly over the decades of their subsequent lives. So this is a complexity in using the APT model, so sort of taking off of James' thought about, well, the period effect may be the main story that may absorb much variance from the cohort measures. Okay, thank you.
Just to first, Vladimir, you want to answer something?
Yes, thank you very much for giving the floor. Yeah, thank you for good comments, Julian especially. And yeah, generally, as you mentioned, it is a problem for comparison 2008 crisis and 2014 crisis because of the differences in methodologies. And generally, one of the key differences in methodology was the so-called imputed rent for those who are living in their own houses. And in these cases, it could somehow change the whole situation of the reallocations and so on. So in these cases, we could see the really biased picture. So in this case, but I suppose that soon after several iterations, 2008 will be adjusted. But there is another problem for 2008 because we don't have very good household surveys apart from only one for this period of time, and it could be also one of the reasons because generally the Rostat, for example, household surveys, they're mainly showing us the picture of the transfers. So in this case, maybe it could be more prospective to take a look at the COVID crisis in 2020, which was for Russia more acute than 2008, for example, crisis, even more acute than 1998. Okay, so for cohorts, generally it is interesting. For cohorts, it is very interesting effect. And generally we looked at them. We didn't use APC cohort, but we just made some estimations, and it showed us that generally the older cohorts, the younger the cohort, the higher is the consumption. So the consumption is growing from cohort to cohort. So in this case, mainly the growing private consumption for the older ages could be explained by the cohort effect. But generally, we should be also careful because maybe it is somehow the effect of the previous crises or something like this. Yeah. Thank you. And about Ron's the earlier retirement in Russia. Yeah, you mean the prospective life expectancy? Yeah, something like this. Yeah, it was close to European one, but yes, it is. It is close, especially for this period. But now, for example, before the pension reforms, it looks like that, especially for women, for example, they had longer period of time living with the pension. But yeah, nice comment, generally. We should mention it. Show the graph how it looks like, how it changed, and so on. As for James,
okay, thank you.
Thank you very much for the comment here. Next time, of course, it will be interesting to show the deltas. Yeah, the changes.
Great, thank you, Vladimir. Now we'll give the floor to Ivan.
Yes, thank you everyone for all your comments, Julien, James, and Ron. Yeah, I agree. The idea of these APC models is trying to um, do some cohort estimates without isolating the period trends. I know it's very difficult because this problem of identification, and that's why we are trying several methods to see the robustness and whether they get some meaningful results. But working on that, and I was very reluctant at the beginning trying to do this research because this problem, and it's a huge problem. But we are trying to get further information and from economic theory and other data just to try to explain, to get some meaningful results. Yes, I think we can do is just improve the estimates at least, like for example, we can improve the power of the estimates by adding more NTA waves, like from 2012 and 2016. That might help a little. And thank you, Julien. I think I agree. In the extremes, we have a lot of noise because we have very few observations, and that also may have affecting the results. And also, James, thank you for your recommendations. We are gonna check your method. We read your papers about Australia. Were very interesting. But we are gonna take a closer look at the method that you mentioned. I think that's all.
Okay, thank you. Now we give the floor to Sean to answer the questions.
Yes, I have a few answers and comments. Thank you very much for questions and remarks, and also some comments. And regarding the questions of Julian and share of people who died or live long-term care facilities, in Japan, the total number of deaths due to COVID-19 is a little bit more than 1,000. And hundreds of thousands elderly are staying at nursing homes and other care facilities. So I don't have such exact figures of the percentage of the deaths of patient residents, but maybe less than 0.1%, still very minimal compared with other Western countries. And also, thank you very much for your mentioning about NTA location consumptions. This is first time for me to attend this NTA conference, and I'm usually doing research sociologically, and because of my journalist background and face-to-face interviews and online interviews. So I'm going to take into considerations your comments and such economic aspects. And regarding some questions from Karen Hayashida from University of Hawaii, thank you very much. Long comments and questions. And so the comparison with Korean case is also very important and interesting. Yeah, as of now, I did not so much research in Korea, but I'm doing so. And also, you mentioned that if the foreign care worker is very important in Japanese societies, why they have to retain permanently. Yes, I'm also the same opinions. And the Japanese government lost using a lot of money, but many of them are already returning after failing the exam, and also government agreement is not so economically sufficient. So the private dealing is now introduced much more, such as technical intern care workers. And, but we have to be very careful the human rights aspect of this kind of dealing with. And so I'm going to watch several schemes, how they are going. And it is very important how to retain such important care workers in Japan permanently for a very long time. And also who will pay high cost. Yeah, this is high cost should be paid by people's beneficiaries, but also government have to support, because this aging society cannot be sustained without a lot of care workers. And young Japanese do not want to be this kind of jobs, very few become jobs. So I think the migrant is very vital resource, human resources in the future. Thank you very much.
Thank you, Sean, and thank you everyone for attending this presentation, which has been very, very interesting. And see you in the next one. Okay, bye.